This case involves a gentleman in his 70s who had undergone multiple resections of a sternal chondrosarcoma, which unfortunately had recurrences after each resection. He presented with a multiple recurrence that essentially forced us to remove 70% or so of his sternum bone, and a portion of the medial clavicle anatomy was also involved. The unique challenges of chest wall movements, the critical anatomy living immediately behind the sternum, such as the heart, and the limited bone fixation created one of the more impressive challenges that I've encountered in my career. With such a large defect, leaving the defect open would predispose the patient to direct trauma to his heart and progressive spinal deformity, both of which ultimately would be life-threatening. Working with a local bone bank and industry partners, we created a 3D model for an anticipated resection. We then used these measurements from the anticipated defect in the chest that we were able to create, and then were able to identify a matching femoral donor bone allograft, essentially utilizing a third of a caderveric femur to reconstruct this defect. Because of the limited bone fixation, we utilized multiple orthopedic principles to help gain fixation, including plating, long cannulated screws, and suspension with strong suture material. The graft was also supplemented with bone cement to increase its strength, and all of the junctions were bone grafted. These high-risk, high-reward scenarios certainly feed the energy that wakes me up every day with a smile on my face. These types of stories are what drive me as an orthopedic oncologist, getting to work with incredible medical and surgical physician partners, solve puzzles, and help navigate the complexities that cancer presents us as a team. Such a multidisciplinary effort is only possible in environments such as the clinic, where we can put multiple experts from seemingly disparate specialties in a room together in order to solve these challenging problems. There are no such thing as lone cowboys in the world of complex cancer surgery. My partners are my lifeline and my fuel, and being able to tell a patient that we got your cancer out and surgery went off without a hitch can only occur when you have partners that are united and invested in the common goal.